Good morning, everyone. As you can see, I am not in my uniform, so it's my rest day today. So I'm just out and about in town. I just wanted to do a quick reflection of my last jobs that I had the other day, because they were really interesting. The first one, because we had quite a few, but the two main ones I had was what I'm talking about. The first one is about this lady. She wasn't very well, obviously, in that she presented quite quiet. She was sort of middle to late middle age in the age group. But what threw me is that when we did our temperature with a tympanic through the ear, the tympanic didn't record anything. It was basically saying low, low temperature. So that sort of sparked a few questions in mine and my paramedic's mind. So we switched to the another tympanic, which records it automatically through the box, and it still didn't pick up anything. When they got to the hospital, apparently they had to do a rectal temperature, because they also had low, and her temperature was 34 degrees. Now, my para says at 34 degrees you are basically on the borderline of hypothermia. Now, some people would be unconscious at that one, but this lady was actually quite bright in comparison to what she had going at the time for her. But it surprised me, it really did, because her skin was actually quite warm to touch. And I just thought it was me putting the tympanic in her ear incorrectly, but obviously it wasn't. My paramedic informs me that it's a form of sepsis, and in the end, it's an indicator for sepsis, sorry. And basically what's happened with sepsis is that the body is trying to help itself by attacking what it thinks is an infection, but there's no, so basically it overreacts or something like that. But sepsis is really, really dangerous. So it can happen anytime. You can have a scratch on your hand, it can turn into sepsis. Makes people very, very sick, and eventually it can actually kill. So that's a very dangerous thing to have happen. But apparently hypothermia, or low body heat, is a sepsis indicator, which I didn't know that. So that was really interesting. And she's fine, by the way. We got to the hospital fine, nice and quick, and the nurses and the doctors did their magic on her. The other thing was quite interesting is went to a gentleman who had fallen, and we found him on his side, and he was quite talkative. GCS 15, you'll get to learn that when you're when you do the ambulance service. If you haven't learnt it already on Casualty or Hobby City, and he said he hurt his leg. Now, when I looked at the leg, it looked very swollen on the side I could see. And on the underside, it looked like it was a little bit bent, but not terribly bent. But the first thought that goes through, or should go through your mind, is, sane safety situation, is the patient triangle, is there any catastrophic blood, and then do the rest of your assessment of the patient, down to like the C-spine first and everything else. And it was really nice to have a comment back from my paramedic to say that the foot and the leg didn't dissuade me of actually doing my assessment in the correct way. So a lot of people, when they see quite horrific injuries, they really sort of pinpoint to that particular problem without actually looking at the larger picture, and making sure that the patient's breathing okay and there's no other broken bones or anything, no catastrophics and things like that. So that was really, really nice feedback from my paramedic. when we turned him, we were able to turn him on his back, and we saw the state of his leg properly. It hadn't broken the skin; it was just bruised and red, so it was almost breaking through the skin of his leg, lower leg. But it was at a very, very bad angle. Okay, so you see, yeah, it's broken. You're going in. You're not going to be walking on it. But his pain threshold was really good. I mean, he was saying, it was about 2 out of 10. Obviously, when we touched it, it was like 9, 10 out of 10. So, yeah, pain thresholds for patients, they can be... there could be any amount of pain, and they could hold their pain back really, really well. Some people find pain a lot faster than other patients. So when you do the 1 to 10, what's your pain threshold? We usually say, 1 no pain and 10 the worst pain you've ever had in your life. Not worst pain imaginable, because you can imagine maybe getting squished by an elephant and not being able to breathe and dying. That's a pretty painful thing, but I've never had that done, touch wood. So I wouldn't know what that 10 out of 10 would have been. So my 10 out of 10 will be the few minutes of giving birth, maybe, So it depends, what's your pain threshold. So those are my 2 interesting ones I had recently. Really, really good session with my paramedic and a student paramedic, because we made we on the DCS, which is the double on the main ambulance. So I was ECA, had the paramedic and a student paramedic with us as well, and it was really nice to work all together, But yeah, so I'm about to go and do my usual bits and pieces. I need to get my lunch for tomorrow. So I'm training tomorrow. It's my 2nd day of training at the end of the year, which everyone has to do. And that's conflict resolution. So I'll let you know how that happens. All right, drive carefully, stay safe, and see you later. Bye for now.